This news segment is brought to you by Star Furniture.
Welcome back, everyone. It is thought fatigue is involved in 1 in 6 fatal road accidents, and some studies even suggest women need up to an hour's sleep a night more than men. Not getting that extra hour could be one reason women are more susceptible to depression than men. A couple of factoids for you, and the man who knows all about it and all about sleep problems for that matter is here. He is Dr. James Ludwick with the West Houston ENT and Sleep Center. Dr. Ludwick, thanks for coming in.
Hey, thanks for having me back. I really appreciate it.
I had no idea. 50 million Americans suffer from sleep disorders. There's over 70 sleep disorders, I understand. What are those numbers accurate before I throw out bad information?
They're pretty accurate.
Ballpark?
Yeah, ballpark.
What are some of the major situations and problems you treat and see every day doing what you do?
Well, by far the most common complaint or symptom that we see is patients with sleep apnea, but we also treat patients that have, insomnia, they can't fall asleep, can't stay asleep, they're tired during the day, restless leg syndrome. So they have bad sleep hygiene, they're not sleeping enough, all sorts of things that can make people not feel rested during the day.
That's what I was going to ask you. What are the telltale signs for people that will have sleep disorders? I mean, obviously, if you're working long hours, or I asked you earlier about Fox 26 morning news hours. I get up at 2:15 every morning, which definitely makes me feel a little bit more fatigued. But there's a lot of factors that go into having a particular disorder.
Right. Yeah, actually, most patients, they have a kind of a cocktail of problems. It's not just they have sleep apnea or they have a bad sleep schedule. They may have bad sleep habits. They may have reflux waking them up at night. There's actually a lot of things that can go into making people not sleep well, not feel well during the day. So they're usually tired, sleep is restless, they don't wake up feeling very good. Those are the main kind of symptoms that people have.
And oftentimes, I understand, people will generally just go to their general practitioner and say, hey, I'm having a problem sleeping, which then you kind of get sent all around to go to the specialist, this, that, and the other. A little different at your place. I mean, you guys are all centrally located right there when you're dealing specifically with sleeping disorders. Tell us about what you all do at your place.
Yeah. So at the West Houston ENT and Sleep Center, patients are going to see me, and I'm going to go over their sleep history with them. When they go to bed, when they wake up, what's going on at night, that they having reflux, they have pain, any other issues that are getting in the way of their sleep. Do they snore? Do they stop breathing? Is their sleep restless? And then after we go over their complete sleep history, then I'm going to do a full head and neck exam, because a lot of patients that have, for example, sleep apnea, they'll often have things like deviated septums or poorly controlled allergies or sinus problems, big tonsils, adenoids, things you hear about commonly. And once we have that complete picture of their history and their exam, then I spend a lot of time teaching. I spend about 30 minutes per patient for a new sleep patient, and when I teach them all about sleep apnea. What are the sleep stages? When they finish with going through the animations and our charts and graphs and things that I have, the tools I have to teach, they really understand what is sleep apnea and what the problem is.
Before going to a doctor and you're sitting at home and say you're having a few restless nights, you're not able to sleep, how do you know? Is it a fine line going from I have a disorder to I'm just a little not well rested at this time? How do you know when to seek professional help?
Well, I mean, there are definitely some telltale signs. No, one bad night's sleep doesn't mean you need help. But these patients, that have sleep apnea, it's a chronic, medical problem. They have, they're sleepy all the time. Their sleep is always restless. They may have high blood pressure, heart disease, heart failure, arrhythmias, all sorts of chronic medical conditions that are caused by having obstructive sleep apnea.
And very quickly, because we're just about out of time, when you're dealing with sleep disorders, is this something that is covered by insurance?
Right.
Generally?
Yeah, I mean, it is covered by insurance, and frankly, no matter where people go, their insurance is going to cover their sleep study or whatever. But at the West Houston ENT and Sleep Center, what's nice is that because we're office-based, our facility is on-site, whatever your benefits are, they'll be the least expensive at our facility.
All right, good information, Dr. James Ludwick. Thanks again for coming on, and I appreciate shedding some light, so to speak, on this problem. Natalie, over